Let's begin with the three things to know about the coronavirus developments today. First, the University of Connecticut has canceled commencement exercises. Classes will be online for the rest of this semester. The official number of cases in Connecticut has now jumped to 68, but no deaths have been thankfully reported in our state yet. More than 5,300 people in the U.S. have coronavirus, and at least 100 of them have died. Much new information on the coronavirus in Connecticut today. We're also getting those new numbers that show the strain it's putting on all of us. Channel 3 Eyewitness News reporter Matthew Campbell was at the governor's executive residence in Hartford's West End. And Matthew, what are some of the biggest takeaways of what the governor told you there today?
Yeah, Dennis, I'm actually going to start with what Dr. Matthew Carter was telling us today. He says, yes, there are confirmed 68 cases in our state, but because we got so behind on some of the testing at the forefront of all of this, we need to multiply that by 100 and actually operate as if there are 6,800 cases right now in our state. And again, we are just in the infancy of all of this. Now, we asked about the capacity at hospitals and the strain this will eventually put on them. He says we have 9,000 hospital beds in our state, but he could not even guess at how many we're going to need when this virus peaks. We asked if there's any indication when it will peak, and again, no firm answer. It was stressed, though, that this is just the beginning, and even though the hospitals are not at capacity now, eventually it'll likely get there. And we're already starting to see some of that at Greenwich Hospital and also Danbury Hospital. So the state is already looking at alternative sites for hospital work to be done. We heard the possibility of dorms or hotels. None of that has been locked down or decided yet. Those are just options that are being looked at. Now, the governor is forecasting the real strain this will put on our healthcare system, and he's calling on retired nurses to come out of retirement.
Seeing what we can do to get more nurses available now. We have a number of trainee nurses. We're accelerating their certification. We're also reaching out to retired nurses, those that are retired. We need you, and we're going to need you over the next 2, 3, 5, 6 weeks.
Now, another sobering stat is the unemployment rate. Usually on an average day, we have 5,000 people on unemployment, or 40,000 people on unemployment on an average day. During a recession, 5,000 people a week apply, but just yesterday, 10,000 Connecticut residents applied for unemployment benefits. And we are learning that's probably going to spike even more now that the casinos close at 8 o'clock. Many of those workers will be furloughed, and we did learn that the state is actually easing up on some of the qualifications for unemployment, and furloughed workers will now qualify for unemployment benefits. That is the latest. Live here at the governor's mansion. Matthew Campbell, Channel 3 News.